Hi, thanks for joining us and welcome back to the American Society of the University of Haifa's weekly COVID-19 update. Delighted to be joined by the wonderful Dr. Manfred once again, Director of the University of Haifa's International Masters Program in Public Health and Global Health Leadership. Now, if you've been tuning in to our previous sessions with Dr. Green, you'll have seen him dissect a new issue each week pertaining to the latest developments around the pandemic. This week, we're going to do things a little differently. We asked you to send in your questions and Dr. Green will be answering them on today's live chat. I also just want to point out that if you have any questions, please feel free to send them in via the comments and we'll do our best to get to them too. So Dr. Green, thanks again for joining us today. Our first question.
Nice to see you.
You too. Our first question sets the scene a little here. With us approaching around 90 days of the coronavirus in the US and Israel, what have we learned scientifically about this novel virus that could potentially prepare us for any rumored second wave?
I think that we know what the virus is, and we know that it's the coronavirus family. So we do have information about how coronaviruses behave, and they tend to behave somewhat differently in many respects, but they are still the same family. We're learning mainly about what's been happening in other countries, and so we're following that very carefully. And we do have good information now on how the virus spreads. It's basically a droplet spread, although there could be occasional airborne spread. We know that it can spread very easily, much more so than influenza. And there are the so-called super spreaders, where people who have been able to infect a large number of people. So we know the basic way in which this virus is spreading, and unfortunately, it's a virus that can cause a lot of damage. So we know that it can have a major health effects, although most of the time it's a mild illness. So what we're really doing now is trying to establish ways where we can limit the spread. And in a sense, we're buying time so that we can actually improve treatment and hopefully develop a vaccine and manage this virus in a way in which it doesn't impact too much on our society, and hopefully allow us to get back to what we would call the usual, usual living, with opening up the economy and opening up the society.
Great. Next up, next question we had was, with Israel starting to reopen, and really it seems like Israel's going back into normality very quickly over here. What are your thoughts about this? Do you think the government is doing this in the smart way? And what restrictions do you think should continue to stay in place as we start to return to our normal routines?
Yeah, I think the guiding principle both here and elsewhere is to open up in a way in which you make sure that the health services particularly are not going to be overburdened. So basically you will open up and watch for new cases. I don't think you should panic if there are new cases, because that's something that will happen probably inevitably. But what we want to do is to make sure that they don't spread too far. And if we see that the spread is in a sense out of hand, in other words, it's spreading too rapidly, then clearly you would have to consider then introducing some of the restrictions. And it's going to be a question of balancing between wanting to open up the society and making sure that you don't get this sudden spread. I would predict that in the summer, it's not going to spread as rapidly as it might do in the winter. Now, we still don't know, but this is our experience with many of the respiratory viruses. So it's quite possible that we'll get an increase in cases, but that it doesn't necessarily mean that that's going to explode into a very large outbreak. That could come obviously in winter.
Right. So this was, I found, a very interesting question that we had sent in. I guess with so many different antibody tests being circulated by different companies, some tests have reportedly returned positive due to a person having antibodies of another strain of coronavirus, such as the common cold. Can you speak to some of the issues around testing and also some of the public health ramifications of someone thinking they had COVID-19 when in reality they simply had similar but different antibodies?
Yeah, I think what we're talking about is, again, the so-called sensitivity and specificity of these tests. What these tests do basically is they test whether, in fact, you have encountered the coronavirus and you've produced antibodies. But remembering that your body will produce antibodies against parts of that virus that may, in some respects, be shared by other viruses, particularly in the same family. So you do sometimes get what we call these cross-reacting antibodies, that an antibody towards one will slightly, or to a more extent, react with another. If it's a good test, and that's what people, what's basically being established against, like the spike protein, which is one of the antigens on this virus, and that's where your body will recognize it as an antibody. So you will be looking to see whether you can get a very specific antibody. In other words, it doesn't cross-react with something else. So let's just answer your two. What happens if it does? Well, again, it depends to what extent. If it's from an individual level, it just means basically that you may think you're immune and you might unnecessarily expose yourself. If it just means being in the general public, it's probably not a major issue, because in any event, we're gonna be all gonna be exposed at that level. But you wouldn't want, let's say, healthcare workers to think that they are immune and then relax their protective gear. That could be a real problem. So and certainly if you're going to have people who are sensitive, particularly to the virus, elderly and chronically ill people, they shouldn't have people coming in unprotected because they think they're immune. So in that respect, you have to be careful. From a public health point of view, these antibody tests will really give us a general idea of the spread of the virus. It will tell us about how far it's spread, particularly in terms of those who hadn't had symptoms. And there are a lot of those. So in fact, but it doesn't have to be very accurate at that level, because we really want, at least at this stage, we want a general picture of what's happening.
Gotcha. I guess continuing on from that, Governor Cuomo said on Friday that the facts continue to change with this virus. The most recent example of this is the CDC recently changing its stance, saying that the virus is not transmitted from surfaces, contrary to what they originally said. How do you explain this constant flux of data that we continue to see?
I'll divide this into two. Sorry about my voice. The first part is basically the science and what we know about it. And the second is how we communicate the science. I think that the scientific part is done pretty well. We do okay with it. We try and learn about it, and we make progress, and we sometimes have to modify facts because we've learned new things. Our communication is often not very good. And that's, I think, where we failed very frequently. So if you get a scientific answer that says that the virus can be detected on surfaces, that doesn't mean necessarily that you can assume that it's going to be easily, sorry, sounds like it's not corona, by the way, not yet. It can be spread. So you'll say, well, okay, the virus is around, but that doesn't mean it's going to spread very widely from there. So I think what is happening is there's accumulation of data which says, even though the virus can be found on surfaces, that doesn't mean it's going to be easily spread from surfaces. And that's probably true about many. So in a hospital, you'd be very careful because of the amount of virus and bacteria around. So you'd have to be very clear. But as you know, there are a lot of viruses and other things in the environment, and most people, generally speaking, don't get infected by the surfaces. They're more likely to be infected by people coughing or breathing on them. So I think this is the issue here of not saying categorically this is good or bad. I think this is the mistake, by the way, or if you call it a mistake, with the masks. I think the communication about the masks initially, of saying masks are not effective, was not good communication. That wasn't true, really. I mean, anyone with a little, shall we say, common sense would recognize that if you can physically protect yourself, it'll provide some protection. The question is how much protection. So I think initially it was better to say that it didn't seem at this stage that if you were just in the general public, it would provide much additional protection. When we have a higher level of risk, that extra level of protection would be useful. And that probably would be the best answer.
Right, right. Look, I think the final question we'll have time for today, and it's one I personally wanted to ask. Dr. Green, you were one of the university's 18 faculty members who were awarded funding for the Israeli Ministry of Science and Technology to draft coronavirus-related proposals that the government is partially subsidizing amid the pandemic. First of all, congratulations, Dr. Green. And secondly, can you share with us what you hope to achieve with this funding and what kind of COVID-related research you're working on?
Thanks very much. What we're looking at a very, shall we say, in a sense, obvious question. The actual lockdown or the restrictions imposed is certainly going to prevent the spread of the virus and help us to reduce the mortality, at least to spread out the spread of the disease over time so that we can cope with it. But at the same time, this is at an incredibly high expense to the economy and other issues. So that's something that's being dealt with, and more or less you can do a cost in terms of lives saved and in terms of what it's done to the economy. I think what has not sufficiently been looked at, although it's been looked at, is actually what we would call the so-called collateral damage. In other words, when you lock down, people don't go to the hospital for treatment that they need. People are isolated and then they suffer from depression. Or they're not eating properly, or they're not exercising properly. So there are a lot of things that are basically collateral damage. So what we are looking at specifically are trying to estimate the costs of the collateral damage. In other words, what does it cost to shut down? And that should be added, in a sense, to the cost to the economy, because these are actual health costs which are not directly measurable in terms of production and so on. And what we hope to achieve is actually to suggest that, in fact, in the future, when we are doing these lockdowns, much more attention should be paid to this collateral damage. And I'll give my last comment, which I make sometimes. It's a little provocative. I personally believe that we're going to be with this coronavirus for a long time, COVID. So I think we should plan for it. I think I might have mentioned to you, I really believe that we should look at the possibility of establishing infectious disease hospitals. I know this sounds like a huge undertaking, but possibly in a way we could do that. Separate the people who have infectious disease, and particularly COVID, from the regular hospitals, so that people are not afraid to go to regular hospitals. I know that sounds like a major project, but I think it'll do two things. One, I think in many ways we need an infrastructure even for the future to have that, and it can be used for dual purposes anyway, for other reasons, when it's not being used for infectious disease. And I think that the other thing is that that's going to give a lot of work to people building hospitals, so that's going to stimulate the economy.
That's right. That's right. Brilliant. Unfortunately, that's all we have time for today, but please.
Thanks very much, Dave.
Thank you, Dr. Green. I want to let everyone know, please continue to send in your questions, either here on Facebook or email them to info@asuh.org. And we'll do our best to work with Dr. Green and get back to you offline. Additionally, we'll also be back here at the same time next week too, so be sure to tune back in with us then. As always, for more information on the university's response and briefings around the pandemic, we'll actually have another briefing this coming Thursday around mental health. So tune into that and look out for updates. And finally, to support the university during this time, please find the link included within this post. Thank you very much, and please all continue to stay safe and updated. Take care.
Thank you.